Hello, my name is Zona Fussell. This is week 3 discussion number 2. Sorry that you can't see my face talking, but my computer has froze up, as you can see, and it's still turning, so I just put my picture up there with my voice. I was on the negative group, chosen to be on the negative group, so I'll be discussing the negatives of power. Power has many negative connotations. Calling someone power hungry, power driven, conjures up images of ruthless, domineering, dictatorial behavior by leaders, sneaky, cunning, manipulative followers. In other words, it means that when management are doing things that are underhanded, they oftentimes have people who follow them to help them get those things done, knowing that it's wrong. French and Raven define power in terms of psychological relationships which influence can change individual perceptions and behavior, can cause them to do things that they know are not right, but in order to get that gain or recognition, they will follow and do what they are told. What are the sources of power seen in an organization? Give the definitions for each source. Coercive power involves a dependent relationship between the driving agent, recipients of force. Legitimate power derives from authority and social and cultural norms, involves loyalty, social rank, and the organization's hierarchy, so the influenced individual believes in driving force agents' use of power is just and right. Referent power derives from the driving agent personal charisma and its effect on the recipient of influence. The recipient's attribution of prestige to driving agent leads to desire to please or emulate the agent. Expert power derives from recipient's perception of knowledge possessed by the driving agent of force. Reward power provides an incentive for the person on the receiving end of influence to change his or her behavior, expecting to receive a reward or recognition. What are the negative impacts on organization when its members exercise power and play political games within the Mitzenberg political playing framework? Playing games can have negative effects on the organization by causing them to lose clients, revenue to drop, negative behaviors, and a bad impact on the staff, and have a bad impact on the staffs and patients. Power can be good if it's placed in the right hands, and it can be bad if placed in the wrong hands. Employees who follow management that has power issues usually do it for personal gains, feeling they will get ahead, get a better raise, or a better position. Power is often used in the workforce, healthcare facilities, manufacturing, retail businesses for good, to improve the company, to improve their revenue, to improve their clientele, to just improve employee morale. But there are times that you run into companies that these power issues, coercive, legitimate, reverent, expert, and reward power are used for wrong. A lot of times people that follow management that are doing wrong, they follow them to gain a better position, to get a higher raise, or just because they just like seeing people thrown under the bus. A lot of times management can skip corners. They can sign off on things that are not ready to be signed off. They can overlook a staff member that's doing wrong, that's been making mistakes over and over again, and they can allow that person to continue to work without being reprimanded or held accountable for their mistakes. A lot of times the people that are making the mistakes, they do it because they know that they can get away with it. They know that they'll be rewarded if they don't tell management when something goes wrong, or they'll get a higher position. They tend to look out for each other. Power in healthcare is a no-no, because the main concern in healthcare should be the patient's safety and quality of care while they're in their facility or in their doctors or nurses or staff members' care. A lot of times people have bad days, and you may have run across a nurse or doctor that's in a bad mood, and they may take it out on you. That's not the case. Management should not allow that to happen without reprimanding that staff member, that doctor, or that nurse. But a lot of times it goes overlooked because, and in healthcare, there's no room for error, there's no room for mistakes, there's no room for power, flexing, or anything, because that patient's care is the number one priority when they are in your facility, in your hospital, in your clinic, in your doctor's office, wherever it is. Power, in a negative sense, in my opinion, is when management allows things to go on continuously, when they cut corners, when they know things are wrong and they do nothing to correct it. But because they're management, they may say, well, I'm the manager and what I say goes. And you have to go with what they say because they are management. Again, this is Zona Fussell, Week 3 discussion 2, the negatives of power in an organization. Thank you.